I would love to give a demonstration on how to do an oral cancer screening on yourself at home. I am a myofunctional therapist. However, I am also a registered dental hygienist. And as a dental hygienist, I've conducted thousands of oral cancer screenings on people throughout the course of my career. It's something that I tried to make sure I did on every single patient who came in for a cleaning and checkup, because many times people go to the dentist more often than they see their doctor for a regular checkup. Big things to look for when you're doing an oral cancer screening on yourself at home. You want to pay attention to the color. It's important for you to look around on the various places inside your mouth to make sure that you know what coloration is normal for you inside your mouth. So that way it's easier for you to tell if something's wrong and it's not the right color. Another thing you're going to pay attention for is consistency. Feeling around the inside of your mouth and making sure you understand how things usually feel inside your mouth is going to be very important, again, for you to be able to identify if something is unusual. The other thing I want you to pay attention for is duration. How long has this been in your mouth? Because we all end up doing things here and there where we get bumped in the face, we accidentally bite our cheek, or you can have something like the minerals that are in your saliva get built up in one of your little saliva glands, and it will swell and it will puff up, just like any other clogged pipe or something like that. So those are things that are important to keep in mind. But what I want to show is some things that you can do to check your mouth on a regular basis when it's healthy, that will make it easier for you to identify problems when you're doing an oral cancer screening. So I'm going to glove up for this. All right. Also, this is the weirdest thing I've ever done in my car. Easy way to get started is to check your lips. Now you want to make sure you grab your lips, pull them down and forward, and use some tension there so that you can actually see the whole surface. Notice how when I pull my lip down and forward, these soft areas here are where you're more likely to end up having problems, whereas the hard tissue here is a little less likely to have issues. So you want to check all the soft tissues really well. So grab that lower lip, pull it down and forward like that. Next, you're going to want to look at your upper lip. So you're going to grab that top lip, pull it forward, and lift it up as well. Okay, so now I can see what the general coloration is for my lips on the inside. We want that color to remain consistent throughout the cheek tissue. So you can grab your finger underneath your cheek and look at the inside. Make sure to check the bottom and the top. Other side and the top. Okay, you're going to want to look at the roof of your mouth as best you can. Again, checking for color and to make sure there's not any unusual shapes or bumps that are going on up there. The last one is going to be one of the most important, and that's the tongue and the floor of your mouth. These two areas in the mouth alone make up the majority of where oral cancer is found. Now, in my career as a dental hygienist, I never really was the first to identify somebody with oral cancer. I ended up treating patients after it had already been identified. However, both of those patients were not high-risk patients for oral cancer. Neither one of them were tobacco users. So you really want to make sure you're checking the tongue and the floor of the mouth. So the floor of the mouth is all of that area right there. Okay? Again, you're checking for color, you're checking for consistency, and how long anything that looks unusual may have been there. Okay? These things here, that's your main saliva gland. That's where a majority of your saliva comes out inside your mouth. When you're checking your tongue, you're going to usually grab it with the tips of your fingers, pull it out, and to the side. You really want to check the base of your tongue is what we call that there. So pull it down and out. So you can check all of those areas there. Again, everybody's going to be different. How your mouth looks is going to be up to you to know what looks normal. So there you have it. A straightforward, easy oral cancer screening tutorial that you can do at home. Plus, this is the information that your oral health care provider is going to want to know if you do have something that you're concerned when you go into the office to talk to them. Are there other topics that you guys would like me to explain in more detail or be able to demonstrate for you? Let me know in the comment section. I'd be happy to do any other tutorials or videos that would be helpful.